My name is Allison Schmoldt, and we're doing our group presentation on COPD exacerbation. Other group members are Leslie Harris, Jennifer Lyman, and Maria Kanterbeck. An introduction to COPD. COPD affects nearly 24 million Americans and about 10% of the worldwide population. In 2012, COPD was the third leading cause of death. It also affects men and women equally. And although it's not a curable disease, it can be slowed with treatment. The progression can be slowed with treatment. So it mostly results from tobacco use, but other things such as chemical exposure, industrial pollutants, and genetics can also cause COPD. The definition of COPD is that it's an obstruction of the lung airflow, and it interferes with the normal breathing, and it can also be a life-threatening lung disease. Some symptoms of COPD include increased shortness of breath, chest tightness, wheezing, barrel chest, cough, fatigue, swelling in the legs and ankles, and an exacerbation of COPD can be a change to the patient's day-to-day baseline, which may indicate a need for a change in medication. The pathophysiology of COPD is listed here. It's a little bit extensive, but I'll touch some of the main points. So, chronic inflammation to the cell lining of the bronchial trees caused by smoking and other inhaled irritants. So it increases the inflammatory response, which causes the airways to narrow, and also causes them to become edematous, swollen. And the increased amount of mucus is caused by that, and the cilia in the lungs is unable to excrete that, so it causes a bacterial response. So most COPD exacerbations are bacterial or viral in nature. So we'll start with our case study. So we have Mrs. P. She's a 58-year-old female. She's currently a pack-a-day smoker. She has a sedentary lifestyle. She comes from a low-income household. She has no family history of respiratory problems. She does not have a current primary care physician, and she also hasn't seen a doctor since her childhood. So a little background about Mrs. P. So she's noticed over the past few months that she's been unable to complete the tasks that she was once able to, such as walking to the mailbox. That's become more of a problem for her. She's noticed that she's had to start taking frequent breaks due to increased shortness of breath. She feels like she's rarely able to catch her breath. She does admit that she is a pack-a-day smoker and has been for the past 40 years. And she also doesn't get much exercise. Has a pretty sedentary lifestyle. She's not currently taking any prescribed medications. She does feel like that even though she's a smoker, she's always been relatively healthy. So the last few months she's noticed, like I said, an increase in shortness of breath and some fatigue. She thought that it was just her seasonal allergies that she was having a hard time getting rid of, even with over-the-counter medications. So she comes to the ER today because she feels like with each passing day, her symptoms are progressively getting worse and nothing's changing or getting better. So upon our initial assessment with Mrs. P, we noticed that her blood pressure is 142/91. Her respiratory rate is 30. Her heart rate is 125, so she's pretty tachycardic. She has an oxygen saturation level of 84%. She also has 101.5 temperature. She's using her accessory muscles to breathe. She has diminished breath sounds, wheezing, and inspiratory crackles. So the physician's probably going to admit her to the hospital. He's going to order an x-ray and arterial blood gases, or ABGs. He's also going to start on some oxygen. We're going to start on a short-acting beta-2 antagonist, such as albuterol, and a long-acting bronchodilator. We're going to start her on some antibiotics, and we're going to start her on an oral steroid, such as prednisone. So I'm going to turn it over to Leslie. She's going to start with stage 1. Thank you.